Welcome back. Now, the country's vaccination drive has been stepped up. However, there's also been some skepticism and fear around getting the jab. Now, this is due to conspiracy theories being circulated. To talk to us more about the kind of misinformation that is currently going through the country, Chris Vick, Chairperson of COVID Comms, a non-profit solidarity fund and volunteer organization, joins us this morning. Chris, a pleasure to have you and good morning to you. I think we'll get into the disinformation around vaccines in just a moment, but just overall, disinformation, fake news around COVID-19, the virus that you have detected and data that you have seen. What's it been like for this past almost 2 years?
It's been a constant factor, but unfortunately, as the vaccine rollout program kicked in further, there's been more and more disinformation. I mean, some of us are starting to think that it's almost an organized campaign, because it's moved from hesitancy, which I think is inevitable. I think there are some people who worry about the science and about possible side effects, into very firm opposition now. And there's a lot of social media platforms that have been set up to try and promote a very strong anti-vaccination agenda. And the difficulty, as you and Gareth both know, is in a country like South Africa, where there's a lot of reliance on social media platforms for information, is people are sharing these things without checking them out, without looking at the science, without looking at the medicine. And I think we're in a particularly difficult spot because there's now a combination of resistance and hesitancy that's starting to impact on the numbers.
Right. We're having this conversation so that we can actually demystify some of those myths and actually call out the lies. So what are the fake news? What are the lies being circulated currently?
Well, some of the most ridiculous are that you'll have a 5G chip injected into your arm or a magnet. I've had both my jabs. I do not find myself being pulled towards fridges or metal objects. My cell phone signal hasn't improved. That one's quite easy to debunk. There are others that make your boobs bigger, for example. I'm sorry, I'm not sure if that's for men or for women. But some of them seem to be based on a couple of key arguments. One being that the vaccine was rushed, which is not true. I mean, the COVID-19 vaccine was developed very quickly, but it built on research that has been done as far back as 2010, 2011. Yeah. The other is that the side effects can be very pronounced, and our feedback is that that's not true. There are some side effects. I had a sore arm. Some people get fevers. But generally, the side effects are not worth worrying about either. But I think there's a suspicion around new things that aren't tested. And because a lot of the communication has taken place in scientific language and in medical language, it makes it easier for that mythology to spread, which is why we focus on plain language, debunking debunking the myths, but also making sure that we explain things clearly and in language that people can understand, not just in English, but in all South African languages, just to counter as much as we can the hesitancy and the resistance that we're starting to see.
Yeah, and I mean, that also speaks into the work that you've been doing as an organization, just ensuring that information, accurate, factual, scientifically based information is disseminated. I mean, even with that work, Chris, how has it been received?
It's been very well received. I mean, one of the difficulties we have is a lot of our information moves through WhatsApp groups, so it's difficult to kind of quantify the reach. But the feedback we get on our social media platforms, on our website, which is covidcoms.org.za, and from interacting with civil society groups as we do with government, with labor, and with business, is that the work of COVID Comms is filling a very important gap. That government has focused primarily on scientific and medical language. You remember those very elaborate presentations by Professor Karim with flowcharts, things like that. We just produce single-sheet infographics, sound files, and animated videos. And the response is amazing. I mean, I've had feedback from people in parts of South Africa I've never heard of, who've gone under the illusion that COVID-19 is a result of witchcraft, for example. And once they have access to the information, and through the public service announcements we've been able to do on the SABC and MultiChoice, it's fairly easy to correct the misinformation. People just want facts in language they can understand, in a language they can understand, so that they can begin to talk to each other about what is really going on.
Oh, we appreciate the work you're doing, Chris, and thank you for talking to us this morning. Chris Vick from COVID Comms. And you can catch them on social media or via their website for more information around factual information on COVID-19 and vaccines.